when we're training people on, case acceptance or treatment acceptance, what we try to do is help them understand this idea that you might be with a patient for 5 minutes, but you want it to feel like 15 minutes to them versus being with them for 15 minutes and it only feels like five. And really what I mean by that is you might have to sometimes rush through an appointment because you have three other columns. I mean, by nature, I wish we didn't have to rush through it, but sometimes we do. Sometimes because the patient comes late and then they have to go to the bathroom, right? And we have to do the very best that we can. But I think that where we don't want to rush is, can we give them our undivided attention at the beginning of the appointment? I was in a practice a couple of weeks ago and I found that everybody going to the waiting room was already wearing a mask. And so the patient never had the opportunity to even see my face as a hygienist. And I think that's hard to connect. And so if you are very intentional about your connection and building trust right in the beginning of the appointment, then they feel that presence, they feel that connection to you, and you could probably go through your perio charting or go through the scaling without talking and catch up a little bit that way. So I would say you want to give your patients your undivided attention, sit down with them, look them in the eyes, find meaningful ways to connect with them besides, is there any changes in your medical history? Do you have anything bothering you? And one of the ways that you can do that is keep good notes on your patients as you get to know them so that I remember Mrs. Jones is a golden retriever lover and I love golden retrievers. And we're going to talk about her dog Max for 2 minutes before we're going to jump into everything else. So that if I have to speed up clinically what I'm doing, she never felt that in my just like, my presence and my conversation with her.